Medical Service Centre 7th All India Conference, the national level voluntary socio-medical organization. Medical Service Centre is all set to hold its 7th All India Conference in Bangalore on the 4th and 5th of November. MSC consists of doctors, nurses, pharmacists and other healthcare workers from across the country. The delegates at the conference will discuss key issues like universal public healthcare, merit-based affordable medical education, measures for the availability of life-saving drugs and strengthening of public healthcare among others. The conference will take place at Bangalore Medical College and Research Institute. The conference will be inaugurated by Professor Dr. M.V. Nadakarni, former Vice Chancellor of Gulbarga University. The chief guests of the event will be Professor Dr. C.N. Manjunath and Dr. Ramesh Krishna. Several other dignitaries will also be present at the event from across the country as well as around the world.
We are our Medical Service Centre is an All India voluntary organization which is going for the 7th. Our main purpose is to spread medical ethics, uphold medical ethics, and to see that the people of the country get medical aid irrespective of their capacity to pay. So this is the issue mainly of the conference. And apart from the scientific sessions, we have delegates coming from all over the country, belonging to different systems of medicine, nursing, pharmacy and all healthcare givers. So they have their own issues. So we are discussing, debating and coming to a solution. So this message should reach the people and particularly belong to this profession so that we can strengthen our organization and see that medical aid is given to the people. And we today when there is a erosion of ethics in all the field, including the medical field, so all those who care for it, all those who aspire for it, come under one umbrella and help in delivering this. So this is the main intention of our conference, and many renowned people are associated with us, so many professors and belonging to different fields of medicine. So all of them are supporting us. So we want that more and more people join this organization, strengthen it. This message should go far and wide. This is the intention of the press meet today. Medical ethics, to define, see, medicine, it is not just come into being on one day. There are people who have given up their lives, struggled and developed the medical ethics, medicine, and this is based on the sciences. So when this is our legacy, when we have inherited this legacy, it becomes our obligation to deliver it to the people, not totally getting commercialized, doing service. That is one part of the medical ethics. And medical ethics also, there are so many issues of medical ethics, like maintaining the autonomy of the patient, giving importance to the patient wishes and beneficence, that is, it has to be benefited to the patient, and no malfeasance, that do no harm. That is the basic thing which was upheld by Hippocrates also. Do no harm. So these are the issues which we have to uphold today when it is getting eroded everywhere, when the whole thing is getting commercialized and privatized. So in such a situation, we stand for upholding medical ethics and we inspire the younger generation to join, so that whatever the nobility of the profession which was there once upon one time, now it is going. There is the relationship between the patient and the doctor is getting eroded, and it has become a consumer and a caregiver. Instead of that, the earlier nobility has to be re-established, where the patient believes that the doctor is doing good to us, and the doctor believes that the patient, I am doing the best. So the patient will not unnecessarily sue me for something which is beyond my control. That is very important to build up a relationship. That is the main aim of medical ethics. Now, medical negligence, there can be two aspects. One is a criminal negligence, that nobody supports and the person has to be punished. Sometimes I like to submit that medicine is not complete science. We don't know everything about a patient, but taking the history, examination and with some investigation, we arrive at a diagnosis and start treating in good faith. With all that, we may be wrong. We will accept that we can be wrong. 100% we may not be able to deliver. And sometimes because of ignorance and so many things, patients come very late. In such cases also, we may not be able to do much for the patient. So that has to be conveyed to the patient, and very patiently we have to give the understanding to the patient that we can do only this much. Don't expect too many miracles from us. Occasionally miracles can happen because we are able to diagnose 100% and we are able to give. As I again say, some mishap which may occur which is beyond our control, that has to be understood and not target the doctors or the other personnel for that. But if there is a gross criminal negligence, definitely they have to be charge for it and punishment has to be given.
This is a unique organization, Medical Service Center. It's an All India voluntary Medico-Social service organization throwing light on public health, to improve the public health, to uphold medical ethics. These are the two mottos of the organization. 7th All India Conference begin a new chapter in the health field. That's our hope actually. Since we need a health system which can reach the common people to the remotest corner of the village. That's our motto actually. And the health facility should not be denied to even a who do not have money in their pocket. That's the main motto of the organization. And as a service organization, we conduct wherever natural calamities occurs, we train the medical students to attend those conferences. Because natural calamities, we take them to the spots actually. They can they give service over there. Whenever floods are there in Karnataka, when floods were there, we conducted service camps in floods in 2009 way back. So also other tsunami, so also in super cyclone Orissa, and recent floods in West Bengal, and all these things we've been conducting. And future also we will continue to work on that direction. At the same time, as we want to gear up our students, inculcate a service orientation amongst the health professionals, that will train the medical students and create an ethical wave amongst the medical professionals. That is the main purpose.
There will be a 7th All India Medical Conference of Medical Service Center that will be held in Bangalore on November 4th and 5th. I feel it is a very, very important event. And in this conference, on many matters related to medical education, there will be discussion. One of the important things is we know the whole medical education is getting highly commercialized. It is becoming a global commodity. It has to be stopped. Medical education should be accessible even to the poorest of the poor. A meritorious boy, poor, who belongs to the poorest section of the society, deprived section of the society, they all should become doctors. But today it has become so costly. Even in a government setup, in a government medical college, a poor boy or a girl cannot afford to become a doctor. On this there will be a discussion. Another very important thing is, the central government now, NMC, the National Medical Commission, they have brought a very, very dangerous decision they have taken. That is, they have put a ban on entire South India. There should be no medical college, either government or private. This the National Medical Commission is not supposed to tell. That is not at all their jurisdiction. It is a direct attack on our federal structure, the autonomy of education, the autonomy of medical education. We want more and more government medical colleges, government hospitals. How NMC can tell, don't open it. It is a very, very undemocratic, illegitimate thing they are telling. About this also there will be a discussion in this medical conference. And another very important thing is, you all know, recently for the post-graduation courses, the same very NMC, they decided 0 percentile. Meaning, somebody who has written a NEET exam for PG, even one is below qualified, somebody has failed in NEET exam, even he or she, just because of paying money, one can become a postgraduate. We heard in media that somebody paid 10 crore and is getting a radiologist seat and a pediatric seat. Virtually seats are being auctioned today. People have got money, they are purchasing the seat. This should stop. So regarding this also there will be discussion in this medical conference. Not only discussion, after this conference there will be a plan of action. There has to be a countrywide movement, protester. Students, doctors should come out and protest such decisions of the central government and the NMC.
This is the 7th All India Conference of Medical Service Center being held at Bangalore Medical College and Research Institute on 4th and 5th November 2023. Here we comprise of all people related with health, like all systems of medical practice and all categories of healthcare professionals working for right of people to health. So here we will deal not on just cases or problems, deal upon what ails our healthcare delivery system, medical, nursing, paramedical education, and how or whether does not it at all address the basic problem it is supposed to address, and what are the remedies. So here we will be basically looking at the ills of our health system as a whole. So, and we'll involve students and paramedics and doctors, specialists, nurses, all people with health. We've been working since the last 2 years on this conference in 28 states. We'll be having delegates from around 20 states coming, because entire northeast and north, they are very far away, so they'll be present digitally. But physically we'll be having delegates, about 500 delegates from around 20 states coming here. We also have been interacting on international panel level. Almost 9 countries we have interacted while coming to this conference, where similar health challenges challenges confronting the medical professionals. Like violence on medical professionals is common in many countries, properly not getting proper infrastructure, proper medicine, proper manpower, and the impact of that improper care falling on the healthcare professionals. That is a common problem in many places. Then insurance and corporate conversion of health is a major problem in many countries where the basic healthcare is not guaranteed, like in our country. So we are trying to develop a consensus among the medicos in the Indian continent and also among medicos in different countries of the world. 9 countries we have been able to approach. We will gradually work upon it with 6 monthly projects. So through this, we'll be approaching a humane healthcare system, and so that the system approaches and really can work towards right of people to health based on the anvil of medical ethics.